Today I want to talk about the issue about masks. There have been a number of differing opinions, and the issue can be a little bit confusing. So I really want to clear up the confusion regarding masks and wearing masks. Are they of value in protecting against infection, and what kind of mask to use, how to put it on, and so on. So first of all, what are the types of masks? There are two main types of masks. First of all, there's what's called the N95 mask. I'm sure many of you heard of the N95 mask. The N95 mask is a very special mask designed for healthcare workers coming into contact with patients that are infected. It's a mask which has got a filter in front of it to prevent infectious material getting in. And it's a mask which healthcare workers should be trained how to use, how to put it on, how to take it off. It has to be fit tested so it fits snugly around the face. It's a problem if one has a beard and so on. So I'm not going to deal with the N95 mask. It's really part of the personal protective equipment of healthcare workers, and I really want to talk about the mask used by the general population. And that is the face mask, also called the surgical mask, the cloth mask, which fits in front of the face and secured behind the ears. What I don't want to talk about is the paper mask. Paper masks really should not be used. They can be a problem, particularly if they get macerated, where they in fact can be an infectious trap. So I would not recommend the paper mask at all. It's really the surgical face mask that you want to talk about. Now, what everybody agrees on is that there are two categories of individuals who should be wearing masks. The one is the healthcare workers I mentioned just now, and the second category are people that are infected, to prevent droplets coming out and affecting somebody else. Those two categories of individuals everybody agrees with. Where there are differing opinions, and of course these opinions do evolve as the epidemic matures in different countries and so on. Now, in the cultural usage of masks in the Far East, people in China particularly, where it was now easy to kind of implement universal mask usage, and other countries in the area, the wearing of masks has been a cultural thing for people who've got colds and flus and so on. It was just adapted now to the COVID-19 situation. Some Central European countries have also adopted a universal mask usage, that everybody is obliged to wear a mask when they come into public. So those countries, there are 4 countries, the Czech Republic, Austria, Bosnia-Herzegovina and Slovenia, have now issued free of charge to their population masks, and they now need to wear masks when they go out into public. And now, more recently, a number of other countries are also adopting a recommendation for everybody to wear masks in public. Israel is one country. In the United States, the Center for Disease Control, which is the main public health authority in that country, initially they did not recommend masks for everybody, but now as the epidemic is maturing, they are now looking at recommending masks as a universal practice for everybody. On the other hand, we have the World Health Organization, the WHO, and countries like the United Kingdom, who at present are not recommending masks for people who are not infected to protect them against being infected. There are a number of reasons for it. The one reason is that there does not seem to be any evidence that in fact it is effective in preventing infection to somebody who's not infected. But secondly, there is a problem if masks are not worn correctly, if they're not put on correctly, if the mask slips below the nose, people fidget with the mask, people touch the front of the mask and thereby contaminate their hands. All these things in fact can actually amplify, can increase the risk of being infected. And for these reasons, as well as the fact that the WHO didn't want to run on everybody getting masks, and that there'd be a shortage of masks for people that should have masks, like the healthcare workers and so on. Now, it's very important if one does wear a mask for peace of mind, then one wears a mask, one puts it on, and one carries out a protocol to ensure that a mask is worn safely and that it doesn't in fact increase one's risk. The first thing, before putting on the mask, you should wash your hands thoroughly. There's no point putting on a mask with contaminated hands, bring it up to your face, which in fact can increase your chances of picking up infection. So wash your hands thoroughly before putting on the mask. Put the mask on without touching the front of the mask and secure it behind the ears with the cloth ties or with elastic, as the case may be. Then, once you've got the mask on, you must not fiddle with the mask, not fidget with the mask, because again, you don't want to contaminate your hands. The front of the mask can be contaminated. And also, you should not have a false sense of security when wearing a mask. You should still obey the rule of social distancing, at least 6 feet away from individuals, the rule of hand washing, and particularly once you take off the mask, to again wash your hands thoroughly. So if you feel you do want to wear a mask for peace of mind, or if it becomes a universal practice, it is important that you do obey these rules and these recommendations we're putting on the mask, as I've just mentioned.